Haller, this is something that you had mentioned before. So many moms come in, they're feeling like it's their fault, I'm doing something wrong. Did you feel that, Melissa? What Dr. Haller explained, did you feel, I'm to blame, this must be me?
So 100% I felt that way. My son was in agony for 3 months, and as his mother, I was to blame, you know.
Right.
It was coming to the 3.3-month mark where I had to return to work, and I did not get any bonding time with my son. And I had to return to work, and I thought having a second child really messed up my family.
Wow. Wow.
Right.
Dr. Haller, so at what point should Melissa, I mean, at this point, obviously she wasn't aware, but what point do you start diagnosing or looking for a tongue tie as an issue?
Well, as early as possible.
Right.
Actually, in Brazil, tongue ties are taken very seriously and are done immediately after birth. If
Wow.
the child is born and they see a tongue tie, they handle it right there in the hospital. But in this country, we tend to rely a lot on our lactation consultants who are more taught how to compensate for a tongue tie than actually fix the issue. They are technically not allowed to diagnose. And so they can refer to a pediatrician or they can refer to me to diagnose, but they cannot say, oh, your child has a tongue tie.
Correct.
They can say your child may have a tongue tie. And so many times they don't really know for sure. And a lot of my favorite lactation consultants will say, just go and see. And my consults are free, and if your baby doesn't have a tongue tie, I'm not going to do one. But at least if you're having trouble with the baby popping off the breast, sliding off, falling asleep, all these issues, that's when you either go to a lactation consultant or you go back to your pediatrician. Pediatricians are much more concerned, as you say, with are they gaining weight, you know, and that's very important.
Those are symptoms,
but
right.
the breastfeeding part, ever since we started having the baby bottles, it's kind of like, well, just give them formula, they'll be fine.
Right.
But now our expectations are a little different. We want to breastfeed.
Correct.
We understand there are many more benefits from breastfeeding, the immunological system and the skin to skin. Oh, you know, don't get me started.